Hi, my name is Doodalise Falu, and I chose to do my project on occupational therapy. About OT. An occupational therapist's overall scope of practice is being able to help patients perform daily activities. Occupational therapists often work with those who are disabled, have an illness, or are or were injured. The skills they are taught are often motor skills. The specific things that occupational therapists do are reduced to the age group of a patient. For example, Cindy, the guest speaker from Johns Hopkins, specializes in pediatric occupational therapy. Her job is to play with children and teach them how to play. Someone who specializes in gerontology occupational therapy would most likely help their patients with social participation or things like bathing and dressing if they have a disability or illness. Occupational therapists often work with their assistants, nurses, physical therapists, recreational therapists, and speech-language pathologists. An occupational therapist works with these professions because they all go hand in hand. Each one of them complements each other in being able to determine the strengths and weaknesses of a patient. Working with these professions adds more of a holistic approach, making it faster for a patient to recover. So basically, a patient doesn't have to go to the occupational clinic one day and then go see a physical therapist the next day. So, occupational therapy daily duties are obviously to plan and diagnose treatment and help their patients recover. And then, in addition to that, they have to clean and rearrange the equipment that they use with their patients. Possible work settings for an occupational therapist are a private setting in their own clinic, a hospital, nursing home, schools, or even at home. Depending on the specialization is where they work. Requirements. So to apply to occupational therapy school, there are certain requirements that must be completed. First of all, you need a bachelor's degree to apply. To apply to certain schools, you also need certain prerequisites that are specific for that school. There are also specifics in volunteer hours, personal statements, letters of recommendation, and passing GRE scores. They just have to be checked on the school's website. Once you get accepted into occupational therapy school, depending on what state you are in, it is either a master's or doctorate's degree. In Florida, it is now a doctorate's. To become an occupational therapist and be able to start practicing, Study.com states that licensing is through the state and the exam must be taken through the National Board for Certification in Occupational Therapy, or the NBCOT. Some other basic licenses that most healthcare professionals need are CPR or BLS licenses. ContinuingEducation.com states that an occupational therapist needs 26 hours of continuing education every 2 years. 2 of these hours must be from the Florida OT laws and rules, 2 must be from prevention of medical errors, and 14 must be from in-person or interactive courses. This, of course, is a requirement for Florida. The requirements differ from state to state. And this continuing education just helps an occupational therapy stay in the loop because medicine is changing every day. So some professional organizations include the American Occupational Therapy Association, which is the national association for occupational therapy here in the US, and I actually did an assignment on this association earlier in the semester, and their website is super beneficial because they list all the occupational therapy schools and they kind of just list all the events going on with occupational therapy. Another one is the National Board for Certification in Occupational Therapy. This is the organization in which you obtain a license from. And then for Florida, it's the Florida Occupational Therapy Association. Their mission statement is to support and develop the best practice of occupational therapy to advance the profession and better serve their consumers. I went on their website and looked around, and they also list the different schools, and they list like seminars going on and events as well. A journal I found is the American Journal of Occupational Therapy. It's a peer-reviewed journal that involves healthcare issues that can occur in an OT office, and it involves OT practice and research, and this journal is kept up to date 7 times a year. So my timeline is pretty basic. I'm going to be in school for most of it. So from August through December 2018, my next fall semester, I'm going to continue to complete my undergraduate degree and hopefully start shadowing occupational therapists and start studying for the GRE. For my spring semester, January through May 2019, I'm going to continue to complete my undergraduate degree, hopefully keep shadowing occupational therapists, and keep studying for my GRE. For summer, because I still need a summer credit, I am going to continue my undergraduate degree and take the GRE once in June and once in July. The GRE is now offered online, and you can take it up to 5 times each year. It just has to be 21 days apart, so I'm going to take it twice. And then for my fall 2019 semester, August through December, I'm actually going to complete my undergraduate degree and hopefully do some research, because one of the occupational therapy schools that I plan on applying to, one of the prerequisites is research. In December 2019, I'm going to graduate with my bachelor's degree, and I'm going to apply to UF, FAMU, and West Coast University for occupational therapy. From January to August 2020, during that time period that I'm waiting for occupational therapy school to start, I'm most likely going to be working, maybe in an occupational therapy office, or working on an occupational therapy internship, or maybe just another job, who knows. And then from August 2020 to December 2024 is the good stuff. I'm going to be attending occupational therapy school, and then I'm going to graduate in December 2024. And then in January 2025, hopefully I start working in a corporate occupational therapy office or a healthcare clinic, depends on who hires me. Lastly, these are my references, and I have 2 pages for references just so they wouldn't be smushed up together. Thank you for watching.